watch now. Hope where there was none. For patients with COPD, finally some relief. Medical reporter Dina Baer tells us how.
Chronic obstructive pulmonary disease takes your breath away. With no treatment options other than oxygen, a new procedure and tiny device is helping patients breathe a sigh of relief.
I'd have to maybe stop because I walk real fast. So I had to kind of slow it down.
Carol Folan has lived with emphysema and COPD for years, but in the last two, her pace slowed as her condition worsened.
It was where I go shopping, I'm out of breath, and I was really unhappy. And the doctor told me probably 2 years ago, you need oxygen.
That's the traditional and only treatment option for the condition most commonly seen in smokers.
So this is what emphysema causes for us: destroy most of the tissue of the lung and make the lungs volume bigger.
But bigger is not better. With an enlarged lung, there's not enough room to properly inhale or exhale, and the destroyed tissue doesn't exchange oxygen properly, limiting lung function.
When we breathe, this muscle moves down and up with deep breath. When you are already press it and expanded with emphysema changes, then there's no room for the patient to take a deep breath.
That's where this tiny valve enters the picture. Using a bronchoscope, interventional pulmonologist Dr. Abdul El-Reyes inserted 5 into Carol's lung. The valves open as a patient breathes out, allowing trapped air to escape.
When the patient breathes in, it will close up. When they breathe out, it allows the air out.
The goal is to shrink the enlarged lung over time. The procedure is called bronchoscopic lung reduction.
So over time, the goal is to deflate almost the bad part of the lung. And then by deflating that, because our chest is a closed chamber, that good part take over.
They showed me my pulmonary function at first, and it's about like that. And now it's about like that. So I could take a breath.
3 months after her procedure, Carol's x-ray shows the improvement.
Just keep that up, keep that up.
With less volume in her chest cavity.
Now you're gonna take a big breath in.
The 77-year-old is breathing easy.
Oh, way, way, way better. I couldn't do that before I go.
Are you able to take deeper breaths now?
Absolutely. People should know that they have a chance, even with COPD. Because that's what they tell you, no, there's nothing we could do. And there is, and people don't know it. I walk fast, and I still can walk fast, you know.
Carol is so thrilled with the impact. She hopes to have the procedure on her other lung in the next 6 months. Back to you.